Well, good afternoon, everyone. Thanks for joining us on this last Friday in March. Exciting topic today. We're talking about women's health and leadership. And so we have three great women on here presenting. Our moderator, the current executive director of the Congressional Black Caucus Health Braintrust and Council, Nicole Varner. We have my forever boss, we just mentioned that, Congresswoman Robin Kelly, chair of the Congressional Black Caucus Health Braintrust, recent chair of the Democratic Party of Illinois, and a host of other things. And then our medical expert, we have the incoming president of the National Medical Association, Dr. Rachel Villanueva. So we have two Southerners and Louisianians at the bottom with Nicole and I, and then we have two born and raised New Yorkers on the call too. So get ready for some lively conversations, and I'll turn it over to Nicole.
We have the battle of the North and the South this afternoon right here. Thank you all so much for joining us today for this important conversation during the ending of Women's History Month. I have with us today, as Brandon mentioned, the illustrious Congresswoman Robin Kelly and the phenomenal Dr. Rachel Villanueva. Congresswoman Kelly, who is the chair of the Congressional Black Caucus Health Braintrust, has served the 2nd District of Illinois since 2013. And during her time, she has worked to expand economic opportunity, community wellness, and public safety across the state. She is the champion for numerous initiatives such as ending health disparities, ending gun violence, and generating job growth for her constituents. She is a member of the House Energy and Commerce Committee and serves on the Health, Energy, and Technology subcommittees, and is also the recent chair of the Illinois Democratic Party. And most importantly, she's my boss. Dr. Villanueva is a clinical assistant professor of obstetrics and gynecology at the NYU Grossman School of Medicine. She earned a BS in biology at Yale University and MD cum laude from the Yale School of Medicine. She is board certified in obstetrics and gynecology. She's a women's health expert and advocate for reproductive justice, health equity, access, and disease prevention, and is the president, if I'm not mistaken, of the National Medical Association, elected this year. And with that, I will kick off our conversation because we have a lot to get through and we want to hear as much as we can from our two dynamic speakers today. Congresswoman Kelly, I'll let you start off with a few introductory remarks.
Sure. I just want to thank Brandon, Garrett, and you, Nicole, for inviting me to speak today. Women's empowerment and health policy gets a lot of attention during Women's History Month, but I know you will all continue paying close attention to what is being done to address maternal and infant mortality, access to health care, reproductive health rights, and all the other many facets of women's health long after March has come and gone. As you know, women's health issues and health equity have been at the core of my work since coming to Congress in 2013. We have made progress in shedding light on some of the health equity issues facing our country, but there is so much more to be done. So I look forward to the conversation with Dr. Rachel and with you, Nicole. Thank you.
Dr. Villanueva, would you like to say a few words?
Sure, thank you. I just am so appreciative of the invitation to come and have this conversation today. I am a big fangirl of Congresswoman Kelly's and her advocacy and efforts to improve women's health and maternal mortality and decrease maternal mortality. I think you know, she's continuing the fight for us. So I really am appreciative to be here with her. I want to thank her for all the work that she continues to do because it's not easy work. And I just really look forward to working together with her as I become president in July, and so that we can really move the needle ahead. Thank you.
Thank you for that. And my apologies, I thought you were already, but I am looking forward to your upcoming presidency.
They're making me work like I'm already president, so it's fine.
Well, you know, Black woman's work is never done.
Never.
So I want to turn to a few questions that we have for you guys today. And since it's Women's History Month, can you tell us, are there any women who've been inspired either of you to lead, or women who you look to today for inspiration?
Well, for me, I always go back to my grandmother. She's no longer with us, but I always think about her. She was just a strong Black woman. And I always think about in the 1940s, she saved money, didn't tell my grandfather, and went and purchased a grocery store and told my grandfather that he was in the grocery business now. And then my father took over the grocery store. But I always think about her and, you know, her faith and her leadership and just her strength, you know. On the political side, I always think of Shirley Chisholm and Barbara Jordan as two great leaders in Congress. And there's so many now that I look toward, that I have the fortune of working with. So I'm very lucky.
Dr. Villanueva?
Yeah, it's interesting because if I really think about it, not in the traditional leadership sense, but also my grandmother is a woman that I think I have very many of the same characteristics, good and bad. In the early 1960s, she came from Haiti and really is the person that brought over my father and his brother and my cousins to come to the United States to just have a better life. And she wasn't a woman of means or education, but she really understood and had the vision that she wanted her family to have a better life. And so there's, I really think about her quite a bit. She really is a motivating factor for me, really always. And so I'm just grateful for her leadership in the non-traditional sense.
No, I think, you know, it's so important to have those people in our lives, even if they aren't maybe, you know, members of Congress or people who hold what we would consider to be traditional leadership responsibilities. Everyone needs somebody to push them and guide them. And so, you know, with both of your grandmothers being such huge influences in your life, I think, you know, that is the exemplification of a leader. So yeah, exactly. What, in your time in leadership, what have you found that the characteristics of a good leader are? I mean, you mentioned some things that your grandmothers had, but you know, you guys have obviously come and done things in a different lane. So what do you consider to be good characteristics of a leader?
Doc, you can go first.
Okay.
I don't always have to go first.
I will always defer to you, so I'm not.
Oh, you don't have to do that.
You know, I think it's such a difficult question, honestly. That's why I was hoping you would go first.
Oh, I can go first.
No, it's fine. I think there's so many things that make people great leaders. And I think there are a lot of different people in my life that I look to as leaders that I would like to be like and model my behavior after, or look to as guides as a leader. And each of them has something different. So, you know, I think one of the most important things about a good leader is that they understand people just in general, understand the people that they're trying to serve and understand the people that they're trying to lead. I think that's really one of the most important things, because I don't think you're a leader by force. You have to be a leader by example, and you kind of have to bring and shepherd people along a lot of times. You know, I think great leaders that I like are usually inspirational. They have a great vision, and they just inspire me to want to complete that vision for them. And so I think that's an important thing about a good leader. I think a great attitude. I think humility is really important in a good leader, and in understanding that you are not the most important person in the room. And I think probably the thing that I need to work on myself as a leader is understanding that failure is growth, and failure is opportunity. And failure isn't where things end. Failure is just another, kind of closes one door and another door is going to open in maybe a different way, but you'll still be able to be successful, even if that one opportunity did not come to fruition the way you expected.
Yeah.
I don't disagree with any of that was said. I look at a leader should be compassionate, the ability to listen, the ability to get out the way and realize they don't always have the best ideas, that the people they're leading may have a better idea. So I guess to be inclusive. And the other thing is to empower the people that you're leading to be the best that they can be.
I think all of those answers are really important, especially as a woman who, will transition into a leadership position one day myself. And in that vein, do you think that there are any leadership qualities that women specifically need that maybe differs from what a leader more generally would need?
I don't know if it's different, but I feel women need to have more confidence in themselves, more faith in themselves, and that they do have the ability to get the job done.
I just want to go back to something you just said, Nicole. You said when you transition into a leadership position, you are in a leadership position right now. So impressive. So I think you're past that, by the way. Congratulations.
Will be leaders and who are currently leaders. So thank you for that. And I'm gonna transition to talking about our newest female leader, Vice President Harris. We've seen the hashtag Follow Black Women, and our Vice President is of African/South Asian descent. Yet there's still a long way to go in terms of inclusion of Black women at the leadership table. In your opinion, where are we in terms of Black female leadership?
Well, I mean, yes, I mean, it's better than what it was, but when you look at the baseline, like I think there's now 24, 25, Black women in Congress, and more women than ever, are running for office, but that doesn't mean, you're winning. But I'm glad that women are stepping up to the plate and, I'm running. But when you look at, there's no Black women governors. Now we are doing in the mayor department, Atlanta, San Francisco, in Chicago, and the mayor of Washington, D.C. So, and more than that, even the acting mayor of Boston is a Black woman now. So major cities, we're making advancement, but when you take everything as a whole, then we still, have work to do. And I'm just talking about the political, arena. I don't know how many, I know the head of the AMA was the first Black woman, or I don't know if it was the first Black person, period, but Black woman to lead. And we're making changes. The new CEO of Walgreens, so we're slowly getting there, but there's more work to do.
Yeah, I agree. Also in medicine and in academic medicine, the number of women that serve as chairpersons of departments is very small. I forget the statistics, and I know I should have them, but I forget the statistics, but it's a very small number. And so I agree, I think we've made incredible strides, and I think we continue to make strides. I think, they should know that women are coming for all of these positions. And I think women bring something special to the table. And I think that's why sometimes they don't want us at the table, because they see that we have we bring something a little different. and think outside of the box and are not always traditional in the way that we present situations or deal with conflict or deal with issues. So I'm just looking forward. I'm just really excited. Just even having the opportunity as now president-elect, even serving in other roles in the National Medical Association, just this position has really opened up my opportunity to be on so many more leadership panels just like this, or just like the fibroid event that I was with Congresswoman Kelly on Tuesday for Congresswoman Clark. I mean, it's just inspiring to me, and it just is a better opportunity for other younger women to see what opportunities are available, and that the sky's the limit for us. There's nothing that we can't do.
Yes, the sky is the limit, and we need to like impress that upon more young women, not just Black women, but women of all ethnicities, because so many of us, like you were saying earlier, feel like we're supposed to be shrunk and quiet and can't be too loud or too brash, and you know, that's such an important message, and I'm glad that you brought that point up. And as we talk about Black women in our roles in leadership, you know, it's a shame that as we get more influence and have the ear of more people and are becoming more visible, we also are dying at a higher rate than any other ethnic group from maternal complications during pregnancy and postpartum. And so now I'm going to turn to a little bit of a discussion about maternal mortality. And for those of you who have not yet had the opportunity to delve into the short American Rescue Plan, Congresswoman Kelly was able to advocate successfully for a provision that would extend Medicaid coverage for women who give birth from 60 days to 1 year after birth, when most of the complications from delivery occur. And so I'm going to ask Congresswoman if you can explain a little bit more about that provision, and for the both of you, if you could talk about how it affects maternal mortality in minority and underserved communities.
Okay. Well, currently Medicaid covers eligible women's care up to 60 days postpartum, but medical research and data show that up to 70% of women will experience birth-related complications within 1 year of giving birth. So the rescue plan included the bill we've been pushing for. So now, and I guess it's the new law now since President Biden signed it, gives the state the option of providing coverage for up to 1 year postpartum. So we feel this is going to help so many women. We want to figure out what we can do for the states that may not take advantage of the option, but we know that for the states that do take advantage, that it will definitely save lives. And, you know, 3 to 4 more times Black women compared to white women die from maternal mortality. And just to say, in the state that I represent is 6 to 1 times the rate. And the last I was informed, it was going in the wrong direction. So there's a lot of work to be done.
Dr. Villanueva, can you discuss a little bit how this provision will affect maternal mortality in minority and underserved communities?
I mean, you know, the issue of maternal mortality for us is so complex. It's so very difficult. But I think that this is one critical layer to addressing, or component to addressing this issue. I think we know that underserved and under-resourced communities die at a higher rate. And very often that's due to the lack of continuity of care after they deliver. So 60 days is really just such a small period of time after a woman has a baby. At that point, probably at 60 days, maybe she's sleeping a little better. Maybe she can think a little clearer. Maybe she's walking normally at that point after a delivery, C-section or vaginal. But there's so many things that occur that can potentially occur after that point. And these are all preventable things, or a majority are preventable. I can't say all, but a majority are preventable. And we disproportionately suffer from underlying conditions that will predispose us to these conditions, such as high blood pressure, cardiac disease. But I think also what's really important is the fact that that continuity of care will allow providers to really keep an eye on women as far as their mental state as well. We know postpartum depression is a very significant problem in the community. And, 60 days is just the tip of the iceberg as far as care. So again, this is why I'm a fangirl of Congresswoman Kelly. She didn't know it, but I am. And I'm gonna probably say it 12 more times before this hour is over, because, it doesn't seem like it's such an important factor, but it really will save lives. This provision will save lives. And there's so many other things that are kind of in the pipeline, in the works, so that we can eliminate, try to reduce maternal mortality, but this is a very, very important one.
And in the midst of this pandemic, given, the challenges that minority mothers face while pregnant and postpartum, and your work with the birthing population, how are you advising your Black and Brown clients right now to take care of themselves during this pandemic?
Yeah, I think, it's really protecting themselves as we would protect any person, to be honest. I think right now, the primary discussion that I try to have with patients is surrounding the vaccine and getting vaccinated, especially women who are at high risk, either because of pre-existing medical conditions or their jobs, if they're frontline workers, or just have to go to work, take the subway, and put themselves at risk. So for right now, that conversation is always something I really have with any patient, pregnant or not. I'm asking, are you getting the vaccine? And having a discussion. It's sort of interesting. Even yesterday, I just had a discussion with a patient about the fact that she's pregnant. She wants to get she works outside of the home, and she wants to get the vaccine, and her husband doesn't want her to get the vaccine. And so it's a very complicated issue. It's his pregnancy as well. It's her body. So it's the issues are really challenging. But I think the conversation is really important, just to try to listen to people and understand what their reservations are. I think in our community, there's been a big push to say that we're hesitant about the vaccine, and there may be some of that, but I think there was some new data that just came out that said Black and Brown folks really are in that group of people that are wait and see, that really are movable, that if you have a discussion and have their questions answered, even if it's going to cost them, right? How do they get access to it? Where is it available? We're the community of people that actually, once those questions are answered, are willing to take the vaccine. So I think the conversation for me as a physician is so important. I really would love to just tell everybody, just take the vaccine. I really wish I could just say that, just take it. No questions asked, but I understand where the questions come and arise. And so for me, it's been learning a little bit of patience as far as that factor goes. But I think for me, that's important. And then just to reinforce mitigation factors, right? The things that we've all know, wearing your mask, washing your hands, using hand sanitizer if you can't wash your hands, social distancing. I think, as things are opening, I think people are getting a little complacent that COVID is kind of gone, and it's not gone. And so I also reinforce that with patients who don't want to take the vaccine, that it's not gone, it's still there, and it's looking for someone who hasn't been vaccinated to be a host, and that would be you. So, you know, it's just important to keep all of those conversations, that we don't forget those factors, even vaccinated. I'm vaccinated, and I'm just as careful now as I was before. So that's.
And I just wanted to jump into your point. Former CBC Chair Karen Bass commissioned research around the issue of hesitancy and all of that. And we're going to do something in April with the Caucus, but the findings aren't even in the little survey that we did, that people are willing to take the vaccine. That yes, there is some hesitancy, but once they have the information and it's more access, why more people haven't, you know, taken the vaccine. So, but hopefully with the president's plan, he's done a good job in getting so many people, you know, vaccinated. And now, you know, he's saying 200 million. So we're moving on, but it's fine. You know, the findings are more access issues than hesitancy issues.
Quickly, before we turn back to women's empowerment, I'm gonna just ask you to say a couple words to those people who are hesitant about getting the vaccine, who may feel that they could get COVID from the vaccine, or that it was developed too quickly, and you know, folks who may feel shame because they've gotten a positive COVID test.
I would just like to say that and this is what I tell my mother on a regular basis, because she is one of the hesitant people. I'm taking off work next week to bring my mother to the Javits Center because I don't trust her that she won't go. So the conversation is that the vaccine is safe, effective. I think side effects, they're very minimal, right? Just like in any vaccine, it's your immune system just ramping up, telling you it's working. It's doing what its job. And as far as individuals being concerned that they're going to get COVID from the vaccine, they're unlike other platforms of vaccination. The mRNA vaccine actually doesn't have any vaccine in it. It's like the playbook. It tells your body what to do, what things to develop to fight the vaccine, but it actually has no COVID virus in it. So I think that technology is amazing. As a science nerd, that technology is amazing. I think the hesitation or the concern about the speed with which the vaccine was developed, I think is a very valid point. However, you have to keep in mind that this platform, the mRNA platform, was something that was in development for quite some time, right? So we've had SARS vaccines in the past, and so scientists have been toiling away in labs for a very long time, for years and years, working on that particular type of SARS vaccine. And when COVID came along, everybody pivoted. All the HIV researchers, every scientist pivoted towards working towards this vaccine. So it really is a long time coming, honestly, if you're a researcher who's been working on this. I think the word warp speed just scared people, and I'm glad we really don't use that anymore. I think it was supposed to instill some kind of great thing, but it really didn't. But really, they've been working on these vaccines for quite some time. And no one should be ashamed of getting COVID-19. I mean, even, you know, it's a tricky virus. That's why we're in the situation that we're in. The whole world is in this situation. It's not because you were not smart enough not to get it. It's a very difficult virus. It's very easy to get. And so that's why it's so important to get tested. I mean, that testing is really important. And then hopefully, you know, you'll trust enough to get the vaccine, because that's really the only way that we're going to get back to having some type of normal life. And I personally, although I think Zoom has been great, I don't want to have any more Zoom meetings. I want to meet people in person again. So hopefully the more information we can get out there, we'll get back to that normal life.
Hopefully soon.
Very.
I miss seeing people in person. So turning back to women's empowerment, can you describe a moment that you felt really supported and empowered by other women? And what happened that made that moment feel special to you?
I've had, I think, a few moments in my lifetime, but I'll just go to the last one when I was elected chair of the Democratic Party of Illinois. I heard from a tremendous amount of people, but it was really special, the group of Black women that I heard from. And, one used the expression that she's 10 toes down for me. And I had just heard that from somebody else, and then, what can they do that, they're going to make sure that I'm going to be okay. It was one of the very intense 10 days, and it just made me feel loved, to be honest with you, and supported, and that people had my back.
Dr. Villanueva?
I honestly, I don't know. I think, I used to be a competitive gymnast. So I think I've always surrounded myself with groups of women and teams of women and squads of women. I think that makes me feel, that's where I feel most comfortable. And so I honestly can't even pinpoint one time, because I feel like I'm always being supported. I have a fantastic network of professional women. I have some that are in my medical world, and then I have very close friends that are not in my medical world, which I like because that gives me some balance. So I think, I don't know, I can't really point to one thing, but I think it's just really important for women particularly. I think it's very important for us to surround ourselves with other women who continue to uplift us, no matter who that woman looks like, or maybe, sometimes I have a lot of younger physicians who come and are looking for just an African-American woman. And for me, some of the people that have mentored and been a support to me have not been Black or women. So I think it's just, making sure you look for people who are just supportive of you. I'm sorry, I kind of went off on a tangent, but sorry, I went off on a tangent. I often do that. So I'll be quiet now.
And I have to throw in, because if anyone's listening, they'll kill me. I have to say, I'm a member of Sigma Gamma Rho, and my sorority has been super duper supportive of me. No matter where I travel, they show up to greet me and welcome me, across the United States. So.
And I think both of you in different ways made the same point. It takes a village. We say this all the time, and you have to find your tribe, whether that be your sorority sisters or people who just wish you well along the way. I can't tell you the number of times where I've just had one person say one word to me and it meant the world, and I never spoke to or saw that person again. So it really does take a village, and you have to build a tribe or find a tribe. And I guess it's a good segue into our question in the chat box. John Voorhees asks, as a father of 2 young women, I have tried to provide them with confidence to stand up for themselves, but what advice do you have for 20-something women entering the professional world for the first time?
I'm going to defer to you.
I'm trying to think of, not that my daughter's 20-something anymore, but I'm trying to think of, conversations that, that I had with her to relax, that you don't have to conquer the world, in one day, that she was hired because, she brought something to the table that they saw, and, and look for people who, she felt that she could learn from and listen. And, but and when she had a question, ask the questions. I think sometimes, well, I'm going to talk about myself. When I think about my younger self, that maybe I wouldn't speak up and ask the questions that I, should have asked, or didn't take some of the leap of faiths maybe that I should have taken, that I don't know what happened to me when I got into the world of government, because that's how I got where I am, taking leaps of faith, So don't be afraid to fail, it's lessons learned, and everyone has failed, and, just, dust yourself off, get up, and, try again.
And, although I'm the moderator, I think having entered the professional world as a 20-something, finishing law school, I was 25 and I started my own firm, and I didn't know what I was doing, but you ask for help, you know that, you've done all the work, and you trust in yourself and your abilities, and you're here for a reason, you're here for a purpose. And as long as you're being true to that reason and purpose, you're not gonna fail. It might have some delays, but you'll never fail. So that's my 2 cents.
All right.
I think it's important, just what Congresswoman Kelly was saying about having confidence in yourself, that you bring something to the table. They saw something in you, and not to doubt yourself. I think, when I think of obstacles to being a leader or into just advancing into the work world, I think sometimes for me, they're self-imposed. They're not, it's not anybody else. It's my own, doubts about my abilities. And sometimes I need to just remind myself that if that person can do it, I can do it. Anybody can do it. So I just think it's important that to just keep that little voice in your head, that positive voice that says that you can do anything.
And sometimes, I mean, it's been my experience that people have seen more in me than I've seen in myself. Like when I first ran for office, it was 5 men that came to me and asked me to, consider running. And I keep something, I'm looking at it right now in my office at home. It's a cat looking into a mirror, and he sees a lion in the mirror, and it's what matters most is how you see yourself. So I have to remind myself of that even now.
Yeah, definitely. Another question that came from the registrants: what steps should one take to become politically active in advocacy for graduate medical education, residency, specialty recertification, and healthcare reform in general?
I'm gonna let Doc answer.
I'll take that one. I think, I started, it's very interesting, and I'm just going to digress a little bit. It's very interesting because I really wasn't so much of an advocate in, before I actually got to medical school. And I think maybe some of that was I didn't have time. I competed in gymnastics. We trained 3 hours a day. So I really didn't have much time for anything else. And when I got to medical school, the need was so apparent. I mean, if anyone knows the community around New Haven and the disparities that are there, it's staggering when you contrast that to what the institution, the university is like. And so I was really pulled into being a leader at that time. But I think the most important thing, and someone reminded me of this when I was president of the Student National Medical Association, was that you have to graduate. No matter what you do, no matter what advocacy things you do, you have to graduate. So I always think first and foremost, you have to be able to finish so that you can be that leader, right? So that's the most important thing, because I actually did have some members that were on my board that were great advocates and smart who didn't finish medical school. And that's just a huge loss for us. So I think first and foremost, graduate and do well. And I think next, I think there's so many opportunities to be an advocate at every level. So there's a Student National Medical Association. There are a host of organizations all the way up that you can be part of. You can be part of your specialty organization. You can, obviously I'm partial to the National Medical Association, representing Black physicians across the country and largely representing underserved populations. And so I think whatever, some people like to be involved in their OBGYN, like ACOG, the American College of Obstetrics and Gynecology. They are huge advocates in women's health and are fearless leaders in policy and supporting legislation. So I think you have to find what interests you, but I think there's so many avenues to pursue in different areas, and wherever you find your niche, just run with it. Like, be bold and be be strong. I don't know how else to say it. Just really do work and don't let other people, no matter if you're the only person that looks like you in the room or everybody looks like you in the room. I think it's important to just do, to do as much work as you can while you're in these organizations, because representation matters. So if you're at the table, those interests that are important to you and important to us, those will get elevated. And so, yeah, I think there's so many ways to get into advocacy as a medical professional. I think it's great. And
it does help. I mean, ACOG has helped me so much. I've worked with the NMA so much, to help me with my legislation. We don't have all the ideas. We depend on, constituents and advocates to, tell us what's going on, on the ground. So yeah, if you have the time, get involved.
Mm-hmm. Mm-hmm.
But do your work.
Mm-hmm.
Do your work.
I guess since we mentioned ACOG, we have another question. What is being done to reduce maternal mortality in this country, especially Black maternal mortality? Is gendered racism being taken into account, along with how the social determinants of health also play a role in this horrific disparity?
I mean, I'm on my end, I'm trying to pass legislation. I shared my one piece of legislation that was included in the American Rescue Plan, but we have something called, the Mama Act that deals with, and we have a few different things, but we're looking at best practices. We're looking at how review committees, would help. We know in Philadelphia, they started a review committee and their maternal deaths went down tremendously. And also, just education and, awareness. The other thing, which I know this is, further is not going to happen overnight. How do we diversify the healthcare pipeline? And not just doctors, but doctors, nurses, any profession that deals with health. And then also, I'm not a doctor. I'm married to a doctor. My cousin is I wanted to tell you this, OB-GYN that graduated from NYU. but what are they learning? What is I usually don't like the term cultural competency, but for lack of a better term, what is the cultural competency, of docs coming out, even if they are not the same race, but can they understand or have some understanding about the, your experiences and what's going on in your life? So that's what I'm trying to do.
Yeah, I think, like we said before, that the issue is so layered and so complex. And I think what's given me a lot of hope in the past few years is I think people are really collaborating and coming together from all different aspects, right? Medical, social, political, because that's the only way, we really have to attack this issue from all all of those areas, all of those social determinants. I think the overarching social determinant would be structural racism and bias. I think that, as Congresswoman Kelly was talking about, how we're training people, what they're coming into being a doctor, what they think, how they, I mean, actually we know, we have studies that show that residents in training think that Black people skin is tougher. They don't perceive pain as much. I mean, there really some things, and some things are just ignorance, that people don't have their lived experiences don't allow them to know about these things perhaps, but that's no excuse as you become a medical professional, because you're dealing with all races and all women. I'll say, just from my perspective. I think I'm just really inspired by all of the work that's being done, you know, from advocates, from medical professionals, from legislators. And I think, you know, the National Medical Association had a summit, a call to action at our national convention in 2019, our last one where we actually met in person. Luckily it was in Hawaii, and I'm holding on to that Hawaii like sunshine until we meet again. But it was a multidisciplinary group. It brought together, you know, our association has all different specialties. So it brought together all of these different experts, anesthesiologists, cardiologists, internists, all people that take care of women, and how to address this issue from all different aspects. And so I think that's, you know, I think people should know that we are actively working at all different levels to address this issue. And, you know, I think I just feel very hopeful. I feel very hopeful that we will really make a dent in this crisis that we're having.
And that's so important, because, you know, there are so many women out there today, I'm sure, who are hoping to have a family or are currently planning to have a family. And it's so discouraging to hear that, you know, outcomes now for Black women are worse than they were. I know, Congresswoman, when you were having children, the outcomes were better than they are now. And it's frightening for a person like myself, and I'm sure others who are out there. And but I take comfort in knowing that there are advocates like yourself, Dr. Villanueva, and you, Congresswoman, and the folks who are here on this call and who are interested and who are working every day to make the situation better, because we shouldn't have to fear, you know, the normal process of life, creating life and going forward. So those things are so meaningful and so important, especially in this day and age, and the fact that the administration has, you know, made a concerted effort to focus on equity in now, especially compared to the last administration. So can you talk a little bit about, you know, what it means to you for this administration to have prioritized equity, not only in, you know, healthcare, but in all areas? And I think, Congresswoman, you know, maybe some of the initiatives that you are working on with some of your congressional colleagues would be good to discuss.
Sure. I mean, it means so much, especially coming out of the last administration. And, you know, I'm the Vice Chair of Energy and Commerce, and with my colleague Yvette Clark, we have I look at it two ways: an equity working group or a disparities working group, either way. And at first we were just looking at healthcare, but we were challenged to not only look at healthcare, but look at energy and communication and technology and the environment. So we've been, you know, of course, looking at healthcare, but looking at, you know, energy companies and their great lack of diversity. And we talk about tech companies, that's been brought out, you know, their lack of diversity, but energy companies are right up there with the tech companies. And so just studying and building a foundation of what can we do so that there is more equity. And, you know, people talk about the social determinants of health, and I like to say the social determinants of life, because if you don't have the education, if you don't, you know, even looking at COVID, there are areas that I represent that they don't even have broadband. So you talk about e-learning, you know, or telehealth, and it's hard for them to experience that. So there's a lot of work to do, you know, around the equity issue. And I think that COVID and plus what happened with George Floyd, and I'm just saying his name, but we know it's so many names, that it really shook the consciousness of this nation. Not enough, because I was also a part of the insurrection on January 6th, and they don't care, you know, but a lot of people, I think it sent a message home to a lot of people. So I'm hoping, you know, with the administration and then the work of many of us in Congress, and the Caucus works a lot together, Caucus +1 with our native sister, you know, that we will continue to see, you know, changes in a positive way.
Villanueva, did you have anything to add?
I really can't add to Congresswoman. No, I think it's so important to have really from the top down saying that equity is important in everything that we do, right? We're not just looking at one, they're not just looking at like health, they're looking at all facets of life. And I think that just hearing that again makes me hopeful. I think there was a lot of despair coming out of the last few years, and a lot of despair around what happened in our communities during COVID. And I think it, obviously, we all know it highlighted things that I think we all knew. It wasn't a surprise to any of us probably on this call, but I think the fact that now these things have been highlighted, and not only highlighted, but there's action behind it. Right? It's not just words being said now. We're actually moving. We're going to operationalize these issues. We're going to operationalize what happens in these communities. We're going to make this a priority for our country. I think is, you know, I think for me as a non-political person really meant everything to just hear that, and to know that that is the government is working that way for us to make it better for all of our communities. So.
Thank you. So I was texted a question. As leaders, you have a lot of priorities / issues to deal with each day. What are some of the ways that you practice and promote mental wellness and self-care?
You know, I have this event that I've done for 20 years called The Delicate Balance, and it's about women and the balance, you know, and I admit it, sometimes I do okay, and sometimes I don't, you know, do so well. I'm not going to ever say I do well. You know, I'm still learning that myself, and learning, as Nicole can back me up, you know, learning to say no, that it's okay, that I don't have to be, you know, a part of everything. But, you know, I'm trying to not change the world, but at least change the world in my little corner, you know, of the earth. I'm just trying to make, you know, a difference. So, but, you know, I try to, my husband teases me because I started watching Hallmark movies, you know, just something I could just sit there and relax. So I try to get a massage every, you know, once in a while, but it is something I have to continue to remind myself, or take some time off just to be with friends. I don't get a chance to do that very often. I'm working on it.
Dr. Villanueva.
I think that I feel the same. I think I have to really think about making sure that I give myself a break. I think especially with all of these Zoom calls now, I think it's just like, it's like Zoom after Zoom after Zoom. So you really have to build in that time for yourself. I do some mindless TV. You know, on Tuesday, we were on the panel with someone from the Real Housewives of Atlanta, and I was like, I'm on with Cynthia Bailey from, I mean, you know, so I do mindless TV sometimes because I just can't always do the news. And I'm a big exerciser. I think that's always been instilled in me. So I really exercise quite a bit. And for me, that's a big stress relief. Sometimes I get really great inspiration when I exercise, and I can think about things that I want to do or new initiatives. I think it comes when I'm in that, I don't know, those endorphins kick in and it makes me feel good about everything. So my mind works better. But I exercise a lot. And I just make sure now I don't get to see friends as often, obviously. But I'm on the phone quite a bit talking to friends to just, you know, keep me balanced, keep me grounded, and my family, you know, just making sure I, you know, keep in touch with the people that know me well. So that's what I do.
And that's so important to keep in touch with the people that know us well. And we've come to the end of our time. So I don't know if either of you have a parting message. I think we covered quite a bit today. But if you do have a parting message, we'd love to hear it. And, you know, I just like to thank both of you for taking the time to be here today and speak with us and be so candid and open with your experiences.
I'll say something very simple. Give yourself a hug, get vaccinated, and please wear your mask. Thank you.
I'm going to co-sign on everything that was said. And, you know, I just also want to just remind young women out there that anybody can be a leader. I'm really naturally an introvert, so you don't have to be the most outgoing person to be a leader. Everyone has something to contribute, and just know your worth and carry your confidence with you.
Thank you so much, ladies. And with that, I'll kick it back over to my boss, Brandon, my other boss. You're muted.
Right. I mean, after, I guess, over a year of this, you think you figured it out, but, you know, guess not. I just want to thank everybody for doing this call. We really appreciate you, Congresswoman and Dr. Villanueva, and we hope to meet with you at one of your conferences, whether it be the annual legislative conference of the National Medical Association conference or segue and at the National Minority Quality Forums event. Our conference this year will be virtual, and it'll be April 26th, 27th and 28th, and it'll feature both of these women. And so please check out our website and register. Other than that, I hope you guys have a good weekend. Enjoy it, relax, get you a massage, talk to family, and do whatever you need to do to de-stress. Enjoy your weekend.
Thank you.
Thanks, everyone.
I'll be in touch, Dr. Rachel.
Yes, definitely, please.
April 30th.
I'm here. I'm there, wherever.
Okay.
Thanks. This was great. It was really fun.
Thank you.
Much less stressful than I thought it was going to be.
My cousin's name is Elise Carmen. She's she works out of Hackensack Hospital now, but